Dr. Mark Fox, thank you for joining us. I want to start off with just how transmissible is this new Omicron variant?
It's markedly more transmissible than any variant we've seen up to this point. We usually talk about any one person infected with COVID would infect 2 to 3 or maybe 5 other people. This is more on the category of measles, where it's 12, 15, 18 people potentially could be infected by one person. And because we believe it causes more mild disease, people aren't necessarily going home and going to bed, so they may continue to circulate and then infect more people.
And what about in Indiana? Is that a nationwide issue or is it here at home?
Well, so just in the last week, the growth and spread of Omicron in Indiana has really been dramatic. It was just a few days ago that the first case was sequenced here, and now it accounts for more than 70% of the new cases. So that's mirrored what's happened across the country, with it accounting for more than 3/4 of new cases across the United States.
And at this point, folks have already started or planned their holiday. I guess if folks are meeting up and having some kind of gathering, is there a way to still stay safe through this pandemic right now?
Yeah, so the most important thing that people can do is get the vaccine or get the booster if they're eligible. It may be too late, certainly for holiday gatherings for that, but the benefits really accumulate pretty quickly. So I would urge people to get the booster. But if they're gathering in large crowds, wearing a mask, except for those times when you're eating and drinking, will help reduce the transmission. Paying attention to airflow, so having a window open or a fan on will help, reduce that risk as well. And then obviously, if people feel ill or even have mild symptoms, they ought to consider staying at home or trying to get a rapid test at home or at a doctor's office.
And judging by the early data that we have with how transmissible you say this variant is, could we see a return to the highest caseloads that we saw just a year ago?
We expect that we'll see a really high peak, that, we'll see a pretty significant surge in the number of cases, but also that it will likely be a pretty short-lived peak. But the next 4 to 6 weeks, I think, are going to cause an awful lot of disease, and what remains to be seen is the impact that it will have on hospitalizations and deaths. So we haven't seen as many deaths from Omicron, but certainly seeing a lot of cases due to Omicron.
And well, how are our local hospital systems doing at the moment, at least in St. Joseph County?
Our COVID hospitalizations in St. Joseph County were 60 or low 60s before Thanksgiving, and now it's more like 160, 170 people in area hospitals. So, both big hospitals in St. Joseph County are at capacity or over capacity right now. Not all attributable to COVID, but to everything else that people seek medical care for. But it certainly has stressed the capacity of the area hospitals right now.
Hopefully folks stay safe this holiday season. Dr. Mark Fox with the St. Joseph County Health Department, thank you for joining us.
You bet. Take care.